Hi, my name is Dr. Lee Newmeyer, and I am a surgeon. I'm also a professor of surgery and chair of the Department of Surgery here at UF Health Jacksonville. So risk factors for breast cancer, interestingly, the two biggest risk factors are some we can't do anything about. So one is being a woman, hard to change that, and two is getting older, also very hard to change. So, most patients who are diagnosed with breast cancer are somewhere over age 50. Majority are age 60 and older. The statistic that we've all heard, which is 1 out of 8 women will get breast cancer, is really if every woman lived to be age 90, 1 out of 8 of them over that lifespan would get breast cancer. Not everybody lives to be age 90, but it is a very common disease. So age and gender are the two biggest risk factors. Of course, if you have a personal or family history of cancer, and in particular, breast cancer, ovarian cancer, pancreatic cancer in either men or women, melanoma, or prostate cancer, those are all put you at increased risk of getting breast cancer. Other much more minor risk factors are things that provided your body with and your breast with unexposed estrogen or unopposed estrogen exposure, which would include early menarche, so early age at your first period, late menopause, which means that you were older when you had menopause somewhere in your mid to late 50s, not ever having been pregnant, and that's because, again, when you're pregnant, you have different cycling of your hormones. And then also whether or not you breastfed. Now, this is something that those risk factors are all things where we took a whole bunch of patients with breast cancer and we looked backwards to see what were the characteristics of those patients that might be in common in those that had breast cancer versus those that didn't. It may also be important whether or not you were breastfed, but those data are pretty early. So really, it's a lot of things, most of which you can't control. You can't really make a choice about when you start your period. You can't make a choice about when you stop, although I guess you could have your ovaries removed, although those do good things. In my opinion, if we have the motto of the Susan G. Komen Foundation that the best prevention is early detection, that shows you we don't really know what causes breast cancer, even though we can have these risk factors. I would tell you that about 85% of my patients have no risk factors. They don't really have a family history. They were normal age for menarche and menopause. They had a bunch of kids, and they fed their kids. So there's really nothing they did wrong or anything they could have changed that would have prevented things.